So I'm so happy that you are doing well with your therapy, but let me explain to you why your verbiage here is really problematic. So the verbiage that you used in this comment right here, the just happy to be alive, this has been used for decades by doctors to gaslight and to diminish the concerns of women that are going through cancer treatment. I actually had two separate people DM me and mention your comment. They saw it on this post of mine yesterday because they have had this said to them, and it's very upsetting when people hear this, and let me explain to you why. So we can live in a world where multiple things are true at once. It can be true that you're happy that you lived through cancer, that the chemotherapy, radiation, surgery, they all did a great job at whomping your cancer. But at the same time, you can also feel terrible about the aesthetic outcome of all of these treatments. And remember that cancer treatment is done in a couple months, but patients live for decades upon decades with the aftermath of these treatments. Having a poor aesthetic outcome from breast cancer reconstruction can have lifelong psychological impact. Every time you step out of the shower and are standing in front of your mirror, you're reminded of a terrible situation and something traumatic. That visible scar in the middle of your chest, people see that. They ask questions, they wonder. It makes patients feel self-conscious. Why in the world would we ever not try to give people a wonderful reconstruction and a hidden scar? Although you're not bothered by your scar, if someone gave you the option and said, I can put your scar in a visible area versus not visible, would you realistically, honestly choose a visible scar? I certainly wouldn't. I don't know any of my patients that would. So I think we should all be on the same team here. We should want the best possible outcomes for every single patient. And although you don't care, almost every patient I've ever taken care of that has a medial scar is bothered by it. And we should be advocating for patients not to have that because, again, it's not necessary. So not caring about a scar that was placed for a life-saving procedure isn't a morally superior position. People that care about the aesthetic outcome that they're going to live with for decades matter, and they're not inferior. Women deserve excellent cancer care with excellent aesthetic outcomes if at all possible, and all of us should be on the same team. Because again, if you could choose, would anyone choose an aesthetically inferior option? I don't think they would.